Cesarean section, also known as CS, has become quite popular in recent times. Cesarean section is usually recommended by doctors to save mother and baby's life, but there are some women who actually opt for cesarean section due to certain personal reasons. Although CS is very popular nowadays, in Ghana here, it's still quite scary when somebody is told to go through CS, and this is because of the fear that surrounds it. There is so much misinformation out there, so many myths that surround cesarean section, and it's a CS penna coffee must show. Today is Myth Monday, and I welcome you to my YouTube channel. Today we'll be talking about certain myths and misconceptions about cesarean section and get to learn the facts. I will encourage you to subscribe to my YouTube channel and hit the notification button so that anytime I come out with a new video, you'll be the first to get to hear about it. Now let's just get started. Now first of all, let's get to know what cesarean section is. CS basically is an incision made at the abdominal side, the abdominal walls, the uterus, to take the baby out. That's what cesarean section basically is. Now let's talk about the first myth. Hey, CSD, once you do it, always CSO. Now, it's not entirely true and it's not entirely wrong. Let me explain to you. If the duration between your first pregnancy or your first cesarean section and the second pregnancy is less than 1.5 years, that is 18 months, there is a likelihood or there is a huge chance that you go through CS again. Again, if you've had 2 cesarean sections in the past, there is a very high chance, in fact, almost every doctor will advise you to go through CS again, because after 2 CSG, if you go through vaginal delivery, it's very dangerous and it puts you and your baby's life at risk. So that is why you may go through CS again. Again, if there was a medical condition that stopped or prevented you from going through vaginal delivery in your previous pregnancy, and that medical condition is still there, then obviously you go through CS again to save you and your baby's life. But if the reasons why you went through cesarean section was maybe the baby was too big, the baby was not lying the position that was favorable, the placenta wasn't lying at where it's supposed to lie, if these were the reasons why your previous CS was done and this time around all these things are not there, then you may actually be encouraged to go through vaginal delivery again. As I say, vaginal delivery can be done, but then you have to meet all the criteria that promotes vaginal delivery after cesarean section. I would advise every woman who wants to go through vaginal delivery after cesarean section to talk to their doctors about it. If you meet their criteria, try to give birth at a hospital that has a theater, doctors and everything on standby, so that in case this vaginal delivery or the labor process doesn't go smoothly, you'll be rushed to the theater to save you and baby's life. So it's not entirely true that once you have cesarean section, it's for life. Every baby has to come through that procedure. No. Now the second myth we're going to talk about, CSD, they force it on women. Once you get to the hospital you will do CS. It is also not true. Cesarean section can only be done if the woman or her partner consent to it. Yes. No matter how no matter how severe your condition is, okay, no matter how much you are suffering, if you don't permit the doctors to do it, they can never do cesarean section. They can never force you. In fact, you can sue any hospital who forces you to do cesarean section without your consent, without you signing anything or printing anything that allow them to do it. There is so many medical legal issues going on, so no hospital or no doctor will risk his license to do CS for you when you have not accepted to do it. So CS is never forced on any woman. You have to give your consent before it's done for you. Now the next myth we're going to talk about is, CS, if you do it, you'll be bedridden for days and even weeks. It is not true. Go with the days when you do cesarean section and you'll be in bed for like 24 hours, 48 hours, and then we'll be bathing in bed and all that. Now, you can do cesarean section CS in the morning, and by evening, nurses will help you stand up and start walking around slowly. Obviously, when you go to vaginal delivery, you can stand up and start even running if you want to, or if your condition permits it. But when it comes to cesarean section, it's not like that. You can't just start running and going giddy giddy like that. It's slowly, but you can do it if only you put your mind to it that you'll be able to do it. So after CS, after some hours, if your condition permits it, the nurses and midwives will help you stand up and start walking around your bed slowly, and then gradually you begin to increase the pace. So it's not true that after cesarean section you will lie in bed for days and they'll be feeding you in bed for days, bathing in bed for days, and you become basically like just say you become hopeless in bed. It's not true. It's not true. Things have changed. Okay. Now the next myth we'll be talking about is, CS, it is not bad though. If you go through CS and you've not delivered, Oh, Charlie, why are you going to stop that? Who told you that cesarean section is not bad? Charlie, if you go to cesarean section, that is also bad. Okay? A woman carries a baby for almost 10 months, just like a woman who goes to vaginal delivery. They all give birth. They've all had their children. If two women are standing here, and you would never know who went to cesarean section and who went to vaginal birth unless they tell you themselves. So don't let anybody tell you that when you go through cesarean section, it makes you less of a woman and that you've not given birth. You have given birth. Your baby is well. You are also well. Both of you are alive. It's also birth. Okay? Then the next thing we'll talk about is CS. CS is for lazy women. Is the easy way out. Hey, no. You see, vaginal delivery, okay? You go through so much pain, then you give birth. When it comes to cesarean section, some women also go through a lot of labor pain, but when it doesn't progress as they want to, they end up at the theater. Now, there are some women too who actually book for cesarean section. Charlie, the anesthesia is given so that you don't feel pain during the procedure. But once the anesthetic agent wears off, the pain is there. You see, when a small knife cuts you, someone said that you have for bed, they don't want anybody to touch it. So imagine this major surgery. CS is a major surgery. And so imagine the pain. The skin was cut, abdomen was cut, the uterus was also cut. So definitely, even with painkillers, you will still feel pain. Okay, it takes time for the pain to finally goes away completely. And so CS is not for lazy women. No. It's never true. It's not the easy way out. Okay, whether you went through vaginal delivery or you went through cesarean section, you are a strong woman. Be proud of yourself. Now the next thing we're going to talk about is, if you go through CS, the bladder is supposed to come out to get stuck in your stomach. Oh my dear, it is not true. You see, after birth, there is a little vaginal bleeding that continues for a number of days before it stops. Some people believe that when you go through CS, you see the placenta, you see it's usually embedded in or stuck to the uterus. Now, once the placenta comes out, the place becomes a wound, a crow. So it's that placental site and the bleeding here, the coming from. Okay, now whether you went through CS or vaginal delivery, placenta came out, so definitely blood will come out. So if you go through cesarean section, you will still bleed a little bit, just like somebody who went through vaginal delivery. Mojano, it will not get stuck in your stomach, it will come out. Okay, so get that out of your head. Now the next myth we talk about is, cesarean section, if you do, you can't breastfeed, or the breast milk will never come. It is not true. Now let me explain something to you. Most women didn't plan to go through cesarean section. They wanted vaginal delivery, but during the process, something happened. During the labor process, something happened and probably they were rushed to the theater. Because of that disappointment nearby, it has some kind of effect on the brain. Until sometimes, when breast milk, it's starting, it takes time. But once you put your mind to it and relax, you put baby to breast and the baby starts suckling, Charlie, the brain will start working. It will trigger all that it needs to trigger to let the breast milk come. So even if you go through cesarean section, you breastfeed. Breast milk emba, we have vaginal delivery requires emba. If it will come, it will come. So get that mentality out of your head. Even with that mentality, breast milk never emba. Now the next myth we're going to talk about is, CS, mask, putting skin to skin, baby came on and it took the baby away. It is not true. Even in vaginal delivery, okay, if the baby's condition doesn't permit skin to skin, the baby will be taken away to resuscitate the baby, and maybe later on skin to skin will be done. Skin to skin is the baby, you're naked at home under your chest, and then they cover the baby. It promotes bonding and also promotes warmth for the baby. In CS, if you want, you can talk to your doctors. If the baby comes and baby's condition is excellent, the baby can still be put on your chest to promote skin to skin. So even in cesarean section, skin to skin can be done if you want it. Now the last myth we're talking about is, CS it is not true again. If you and your partner are okay and comfortable with your partner being inside there, your partner can be in the room during cesarean section. Even in vaginal delivery, couple it's the same as the CS. If both of you are okay, you can talk to your doctor about your partner being there during the procedure, and they will agree to it. So these are the few myths I want cesarean section. I hope you'll be able to clear some. If there are other misconceptions or misinformation that you have, leave it at the comment section and let's learn all together. Thank you for listening, and Charlie, as I keep saying, subscribe and be good, because me, I am good.